Hi, I'm Michelle Bird. I'm the Associate National Executive Director of the Producers Guild, and it's my pleasure to welcome you to pre-production COVID safety prep. And the session's presented by the Guild's AP Council, and it's my honor to introduce you to AP Council board member, Carrie Lynn Certa. Carrie?
Thank you. Thank you. I am so grateful to be doing this because we've all been in the thick of it. And it's really important to stay on top of the changes in not only in our industry, but in this COVID world. So I'm so excited to have our three panelists with us. We have so much to discuss with the ever-changing, the evolution of testing and protocols and everything, and we only have an hour to do it. So I'm gonna jump right in. First, I want to let everyone know we will be taking questions at the end of the main session. So please make sure you put your questions in the Q&A box at the bottom of the screen. I will be keeping an eye on that. And then I am so honored to have our first panelist here, Dr. Chen. He is the Chief Development Officer for the Innovative Health Diagnostic in Irvine, California. He comes to us via Australia with a specialization in general medicine from the Royal North Shore Hospital in Sydney. He actually came to the US in 2017 and has been very busy this past year, curating unique COVID-19 testing solutions in various industries, not just our own, and provides a deep medical and scientific expertise. Our second panelist is Dan Worthington. He is a veteran and he has over 20 years of management in life and safety systems and operations, project management, along with production experience, which made it very easy to become a COVID compliance officer. It's just a very easy transition. In the past year, he's worked as a CCO on commercials, award shows, network, and non-union productions. And last, I swear we have another panelist. She is unable to share her video because she is in Atlanta joining us and they're having a storm there, but we definitely want to hear her voice. Her name is Tiffany Morrel, and she is a seasoned production manager and field coordinator working in the non-scripted world between non-scripted and scripted. She returned to work May of 2020 to quickly become a health and safety manager for Netflix. She has worked on various nonfiction and scripted shows during this COVID time in New York, Los Angeles, and Atlanta. So she has some stories for us. So first off, thank you, all three of you, for joining us in midday for you. I'm just gonna dive right in. I'm gonna start with you, Dr. Chen, to talk about testing. There's a lot of people are starting to get back to work, you know, productions are starting to ramp up, but there is this misconception on testing. There's still a lot of questions. Can you give us the definitions of the three major tests that are out there?
Sure. So the main testing types people are hearing about are the PCRs, the antigens, and the antibodies. The three of them are they provide different snapshots of what COVID-19 is doing. The main one that we all hear of is the PCR test. And this is sort of the gold standard of testing in the COVID sphere. So what PCR essentially is that it's polymerase chain reaction. And what you're looking for is viral DNA, or in the medical term, we call it RNA. It's very similar. Antigen testing, you're looking at proteins on the surface of the virus. And antibodies, you're looking at the response that the body has to a previous infection. So it's kind of like a hallmark or a remnant that's left behind, and your antibodies are built up and they build a natural immunity to the virus if there's a future inoculation from the virus. So, yeah, what's that, Gordon?
Oh, no, I was going to say, can you please also describe, so when we talk about PCR, you know, a lot of questions like we must have RT PCR, and there is a misconception that RT stands for rapid test PCR. Can you explain that? Yeah,
so RT actually stands for reverse transcription, and it's a type of PCR that we have. So there's multiple types of PCR strategies. You hear of RT-PCR being one, you might have heard of qPCR being another. The way I see it is that it's under the umbrella technology of PCR, there are different ways to perform PCR testing. And so that's where the RT comes from, the qPCR and so forth. So when you hear the term rapid test, that's not so much a scientific term that we use. It's more of a term that's been built up in the community over the many months and years of doing COVID testing. So I wouldn't say RT-PCR is rapid test PCR. That's not the formal definition.
And then also the people who have to administer the test. So we have self-administering, we have technicians administering, and then we have LVNs or RNs administering these various tests. Can you tell us, when is it necessary to have somebody who has a medical background, like an LVN or a nurse?
Got it. So when it comes to nasal swabs, if you imagine your nasal cavity is probably about, I'd say, a couple of inches. So from the entrance of your nose all the way to the very back of your nasal cavity, you're talking a couple of inches. When you talk about nasal testing, you can really test anywhere along that pathway, all the way up to the back. So the term we use for testing the nasal cavity all the way to the back is called nasopharyngeal. And this type of testing is actually quite aggressive. It's definitely the most uncomfortable. People describe it as the brain biopsy. You might have heard of that. And really, that sort of testing only really should be limited to an LVN or an RN performing it. So the term we use is, like I said, nasopharyngeal, or NP for short. The layman term, like I said, is the brain biopsy. So if you've got any vendor that says, hey, we're performing nasopharyngeals, we're performing deep nasal testing all the way at the back, you really want to make sure that there are LVNs and RNs performing it. And it's not because it's discomforting, but actually there are intrinsic medical risks associated with it. Not to dive into the weeds too much, but the back of the nasal cavity is actually very close to the base of your skull. So you hear of these horror stories of people sort of piercing through the back of the nasal cavity and creating base of skull fractures. But I mean, this is really, theoretical more than anything. So, but regardless of that, you really didn't want to introduce that risk at all. When you're talking more of the shallow nasals, sort of like when you go in an inch, maybe an inch and a half, you're really talking about what they either call the shallow nasal swab or a mid-turbinate. You might have heard that. Or the third term you might have heard is anterior nares. When you start going in that territory where it's just at the entrance, the rules and regulations for the medical personnel eases up a lot. So at that point, you can probably start using medical assistants, phlebotomists that have been specifically trained to be able to perform this type of testing. You really open up that window of personnel.
Well, the main reason we're really talking about this is because, as we prep for our productions and producers and CCOs start looking for their lab partners, what questions should they be asking, and so they know they get a viable test and a facility, not only a facility, but a partner with them that's doing it properly. Yeah.
So the types of questions you want to ask are firstly the type of testing they perform. I guess we'll split it into two steps. I like to try to think things in buckets, right? There's the first bucket, which is what happens on set, right? And then there's the second bucket of, okay, everything's done on set, what happens in the laboratory? So when it comes to on set, the questions you should be asking are, do they provision medical staff on site? How often they're going to provide it? What type of medical staff? So whether it's like we talked about LVNs versus medical assistants. There are some vendors that have gotten their testing authorized for self-collection. And in that case, and you have to be specific about this. The FDA simply doesn't say, hey, look, every test kit can be self-collected. When we talk sort of self-collection, more specifically unsupervised self-collection, that means that there's no medical personnel needed to supervise, the layman doing the collection. Any sort of unsupervised self-collection must be specifically authorized by the FDA. So if a laboratory is saying, hey, we can give you self-collection kits where no medical staff need to review it and watch you, one thing I would certainly verify is to look into whether that claim is correct, because there are vendors that are kind of cutting corners here and there to try and gain a bit of extra business. But if they're using test kits that haven't been authorized for self-collection, you end up in a really sort of precarious situation where you might get a lot of false negatives. You get people that aren't collecting properly. And let's be honest, not everyone is comfortable with, doing a self-collected nasal swab. The other things to ask from a collection standpoint is, availability. And actually one thing that is quite important is the check-in and registration process. And I think that a lot of people forget this. Because we work in the medical space, there are rules and regs that we have to follow, things like paperwork, consent form signing, and a lot of sort of the bells and whistles. In those cases, you want to check and make sure that your vendor has a really seamless process. What some vendors can do is they can, sell you the sun and the moon, but then on site when you're doing, day one of testing, everyone gets bogged down with 5-6 pieces of paperwork to sign, and so your 1 hour testing event suddenly balloons out to 3 or 4 hours, and that's highly inefficient. So that's something else to look at, is what is the check-in process? What is the result viewing process as well? For example, will they give you as the CCO or as the safety officer access to results, and how easy is it, right? So that's sort of the front end. So let's now look at the laboratory. So the questions in the lab would be, how long have they been in business? Have they been doing PCR before in the past? Because what's happened is a lot of people have jumped into the COVID testing space, and let's be honest, they maybe didn't have that experience in the past. You want a reputable lab that has experience doing, if not PCR testing, then perhaps some form of lab testing in their past, because there are labs that have just popped up in the last 12 months. Right. And the other thing is the availability of staff Monday to Sunday. So, some labs will only work Monday to Friday, and then Saturday, Sunday, you're stuck in a predicament where they're not open. The other last thing that is interesting is in the testing space, you obviously have positive and negative results. There's this third category called the inconclusive result, where what happens is you do the PCR, it shows some sort of signal, but it's not a definite positive or a negative. And so the lab can ultimately call an inconclusive. And that really puts productions in a bind. I mean, what do you do with an inconclusive? Do you send them home? Do you retest them and so forth? What some labs will do is, instead of calling it inconclusive, they'll say, look, let's repeat the specimen. Let's run it one more time so that we can see whether, this was just some unusual instance that happened. And when they run the PCR, there's a clear positive or negative or not. So the other thing to ask about is how often they get inconclusives. Laboratories that I know that will run a repeat test protocol. So when, for example, sort of circling back, I'm jumping a little. One of the ways to mitigate against inconclusives is to repeat the specimen, is what I'm saying. And so some labs will go to that effort to repeat the specimen to be able to call it positive or negative, whereas some won't and will just call it inconclusive. So the question to ask them is, what are your inconclusive rates? How do you manage an inconclusive? Do you repeat it or not? Oftentimes you'll have to understand that when you repeat a specimen, the turnaround time will extend, and that's something you just sort of have to accept. But a lot of the times the repeating of the specimen will probably only add, I would say, maybe 12 hours more to the turnaround. Let's say they promised you whatever amount, you add on 12, and that should be where you are at with the repeat specimen. So
we're definitely going to go into how to schedule it out too, when to get your CCO on, when to do these testing so as not to stop your production too. So that's really important to know. So, when we were talking about rapid tests before, you and I have talked about it personally, where is it a 30-minute? Is it a 6-hour? Is it a 24, 48? All that stuff needs to be worked out prior.
Absolutely. Yeah. And I think that's about it. So as long as you think about those two categories of, what they do on site and what happens behind the scenes in the lab, you'll cover most of your bases.
I'm going to ask this right now because you and I talked about this literally yesterday. Stephanie Dawson is asking, is a rapid test a PCR test or an antigen test? Good question.
So it could be either. When you ask them, like I said, the term rapid test came along in sort of the common vernacular because people just want quick results. It's not a medical term that we use. Rapid test is never sort of described medically. So you have to deep dive. When they say, hey, look, we're offering you rapid test, you're going to have to ask them the specific question. Is this a rapid PCR or is this a rapid antigen? Both options are available, rapid antigen and rapid PCR. But there are pros and cons to both, and we can, Carrie, I'll sort of divert it to you. Do we want to go into that, or?
I don't want to deep dive into that, but
Okay.
honestly, just sort of hit that on the head again. PCR, you're looking for the actual virus, whereas antigen is looking for the protein around the virus. So they're
Correct.
looking for two different things. Rapid
Yep.
is just the time frame. So
Correct.
you have to ask that question. Let me ask you one more question before I go to the CCOs. We are now hitting this, and people are saying, I'm vaccinated. Look, I don't need this, I'm vaccinated. So tell us about the importance of continued testing in this new vaccinated world.
Got it. So being vaccinated really only protects you. It doesn't protect the people around you. And we've seen this quite often where a vaccinated person who's been vaccinated, a couple weeks or maybe a month ago, they get a PCR test through their employer or for whatever reason, and they've actually come back positive. And so what we do know is that vaccinating against COVID will protect you against getting the really bad ill effects of COVID, but it won't stop you from being a carrier. So what that means is that you're basically harboring the virus in your nasal cavity. You're not being affected because your antibodies are doing its thing and protecting you, but it's still staying there. And it can stay there for a period of time. So you can then imagine this carrier then goes to an environment where, there are unvaccinated people, and suddenly you end up with a spreader event. Yep, Carrie?
No, I'm going to pass it to the CCOs. Have you guys seen, this is for Tiffany and Dan, have you seen any changes in your protocols with people being vaccinated, or are you guys sticking to the same exact protocols?
We've been sticking to the same exact protocols. Just like Dr. Chen said, it really is, it only it only works for you. It doesn't work for anybody else. So we're still keeping the same precautions and just making sure that we've even heightened our things, because we know that people are having that mindset that because they've been vaccinated that it's okay. So we've kind of heightened our protocols on set just to make sure that people stick to what we've been doing until we feel like, until Netflix feels like the coast is clear.
Yeah, Netflix is the hardest one, I heard. Dan, are you having the same issue? Same thing?
Yeah, it's the same thing. So we treated everything as the same as if you didn't have the vaccine rolled out. But we kind of run into this too with testing early on in the game as well, where crew would be like, well, what's the matter? I just got tested yesterday and I'm fine. And you have to explain to them that, of course, it doesn't matter. I mean, you could literally test negative, at 9 a.m. and then have another test at 4 p.m. and now you've, all of a sudden displaying symptoms, or you're testing positive, because that's what it's taken for that. It's just that tipping point for that viral load to catch up, right? So,
Right.
So we've kind of seen that before. We're seeing it a little bit now with the vaccine, and it's just that constant reassurance and reminder to cast and crew that you can still carry it, and more than education, a moment of education to educate them to say, look, it can happen.
Dan, I'm gonna stay with you for a second, since now that people are, more and more productions are starting to ramp up. So producers like myself, when we go out and try to find a CCO, we get hit with all these certifications. You have 11 certifications yourself. You've been working for almost the past year. What should we be looking for on that resume? Can you tell us what certifications are really the ones we should be paying attention to, or what things on the resume we should pay attention to?
Well, I think it's very important that you have somebody who's got some a pretty diverse or robust background in, whether it's in production or it's in management or it's in health and safety or it's in a lot of it. So having somebody who has a somewhat of a robust background or a versatile background where they've done multiple industries, so they kind of see, because there's a lot of things converging at one here, right? So as a CCO, when I go on a job, I have to look at not just the set and the location. I'm also looking at, are we shooting at a restaurant? Well, okay, well, if we're shooting at a restaurant, there's a whole nother appendix of LA County protocols that we'd have to follow, that we have to make sure. Is there going to be an office in there? All right, well, then we have to make sure that we're compliant in those protocols as well. Not just film and TV Appendix J, there's other ones. Then when you get into the certification process, there's some bigger ones out there. The Health Education Services is probably the most robust one. They're the ones that provide those CCO certificates where you take the 2-hour class, and they give you the resources that you would also need to help. So it gives us some little bit of resources and some kind of templates and some areas and where we need to be. Plus they keep evolving their educational platforms along the way. The other thing that you should look for is they should be Johns Hopkins University offers a program, which I've also taken myself, which is contact tracing, which is incredibly important in this industry and where we are as CCOs, because all we do is watch people. A good CCO is going to be everywhere and they're going to see everything. And that's important and that's great to have, because say your guy who's a grip tests positive midday or day 2 of the job or day 3 of the job, your CCOs, if they're doing what they should be doing, are pretty aware of where that guy has been, who he's usually hanging out with, what he's usually doing. Is he good with his mask? Is he not good with his mask? Things like that. And those are all little decisions that go into, okay, how are we going to mitigate this, and how can we, reduce, I guess, potential impacts of exposure to this set. So of course, obviously you have to take all those precautions and shut things down and do whatever you have to do. However, it's much easier to do when you have a good idea of where people have been and where they're, where they lie, if you will, in the circumstance along with that. So it's great to have that as well. World Health Organization has a ton of resources, the CDC, and really, and some of this is kind of tying into what makes a good COVID compliance officer, but they should stay on top of everything.
A question just popped up, while you're filming, I know you're watching people, you're doing a macro, you're doing overall, you're watching everything, from a bird's eye down to an ant, kind of thing. So you're constantly moving while filming. Yes. What is your specific job? Like, are you on lockdown, or are you still walking around watching everybody where the traffic flow is happening?
So while they're shooting, so normally a set, we keep the ratio about 1 to 20, 1 to 25 is ideal. You need to have that for several reasons. Some producers, some productions think that's like, oh, well, we don't need that many people. We just need one person that walks around and says, put your mask on, stay 6 feet. But the important part of that goes beyond that is that coverage, right? People naturally want to hide, they're going to go grab food. They're going to do this. So being in 10 places at once can be quite challenging. And we have to have, almost a dedicated person on every single set, because especially when the talent's not wearing a mask, right, and they're filming, which they're entitled to do, they're allowed to do, we have to make sure that even though they're not wearing a mask, that the director's wearing proper PPE. He's wearing a face shield. He's wearing his mask properly. We have to ensure that the hair and makeup people are wearing their shield. So it's a constant reminder. And as anyone in the film industry is familiar with, it's a constant moving, quick changing environment, right? You got you cut, and then the electric comes in and they do their things, and lighting, and then sound, and everyone runs back. So you have to kind of be above all in all that. So we do a kind of mixture between enforcement, between like that education, between also sanitizing. We might have to sanitize something in between a take.
Yeah, I love it.
I just muted it.
You and I were speaking the other day, you've heard sets hiring set medics as CCOs, but they don't have the proper training. Can you talk about the differences and where that line is between CCOs and set medics?
Yeah, so well, a CCO is dedicated solely to the, obviously maintaining and setting the protocols and helping the production get where they need to be, as well as doing it. And they should have a deep understanding of the protocols and everything else. But the job of a medic is to respond to emergencies and, triage on the site. So they're not allowed to take on a secondary responsibility on set, just as CCOs are obligated to maintain no other job other than a CCO. And the reason we don't have a PA as a CCO versus a actual CCO or a producer or somebody in the industry is for that conflict interest. You need to have that third party that's going to be able to say, look, we need to shut it down. But if I had a financial vested interest in it, I might be apprehensive to shut something down if I have to. So the set medic, that's their job is that. And it really comes down to, when you talk about set medics being a COVID compliance officer, is the medical negligence. Say that your set medic is doing check-in, or he's, it's lunchtime and he's doing whatever, and somebody falls and gets hurt, and it's time sensitive. They have to be triaged. They have to be taken care of. If you have a 10-minute delay in the time that the set medic gets there versus the, CCO set medic guy, because he's not actively watching the work site, you potentially set yourself up for liability when somebody comes back and says, look, you had a medic here, but they weren't doing their job.
Right. That's a good point. It's a really good point. The other thing was, we were talking earlier about mental health and physical health. Obviously, a CCO is all about the physical health, cleanliness, keeping everything sanitized, but there's more than that. It is the mental health and the optics of what you're doing as well. Can you talk a little bit about that?
Yeah, so one of the things I like to talk about a lot too, and just kind of help people understand, is there's some level of optics to our job, right? People are a little scared right now, right? This is something that if they bring home, it's invisible, they can't see it, they don't know. You could be positive or negative this morning, positive this afternoon. There's so many varying variables that change on the fly. So people want to feel safe in the sense of coming to work, whether that's your lowest level to your highest level. We all want to know that we're going to doing our job that we have to do to live, right, to make a living. And at the same time, you're doing it without risking, losing somebody you love or somebody you know, or potentially impacting a stranger, right?
Mm-hmm.
So it's a lot of it is optics, and a lot of it, those optics come down to, leading by example, for instance, right? Like your director wearing his mask properly, your producer standing behind you, your AD standing right there going, look, if we stop, you guys got to put your masks on. I need you, we're all working together to make sure everybody knows who everybody is and that we're going to get this done and we're going to do it safe and quickly as possible, at the same time. The sanitation is huge, right? Obviously, just the mere fact of going around sanitizing and people seeing you sanitizing is going to give them that level of comfort versus, walking wherever. I'm sure at least one of us, if not several or most of us, can say at a time that we've said, I'm not going there because they don't follow the rules and it makes me uncomfortable. You don't want that on your production. You don't want that reputation. And there are tons of productions out there that I'm aware of, and I know others are, where, and in fact, I've been on some Facebook groups and stuff where they almost have like databases of productions that don't follow proper protocols. And so people don't want to work on those productions. So it's usually in everyone's best interest to do what they have to do to keep people safe.
I'll ask this too, both of you, both Tiffany and Dan, come from production backgrounds. You both have very strong production backgrounds. Now that you have this new position, you are a little distant from the production team a little bit because you're kind of at odds. Like they need to move forward. You may need to stop something down just to clean and everything. What are you guys hearing from the production? What pushback are you getting, or the difficult areas that you have? This is supposed to be a team effort, so educate us on that so we can come in this as a partner with you.
I think that for me, a lot of it has to do with down to the PPE to people paying attention is the budget. I think that a lot of times when budget comes in play, wanting to give it 100, but realizing budget-wise you can only do 60, and just them realizing that when it comes to COVID, this isn't something where we can skim. We always find ways in the budgets to get what it is that we need. And unfortunately, this department is an expensive department. We have to test crew. We have to test talent. We have to put all these protocols in place that does push the budget a little bit, but it's just what it is in this time of day that we're in. Also, I think that because people have been doing this for so long and have been in the industry for 20 plus 30 years, they're getting accustomed to doing something totally different and realizing that there's so many other variables to every little position in every department that COVID has their hands in. And they're not used to having someone saying, hey, we can't do this, or we need to have more time to do this because this person needs to get tested, get in the testing cadence. It's so many variables that they don't understand. And when they hire us later on, after the production is already up and running, unfortunately, we have that responsibility of saying, hey, we have to push the stop on this because all of these things weren't done yet. So it's bringing people in place early. It's having the HODs and executives understand where we are and realizing that we can't do things last minute the way we're used to doing, and that there's certain protocols that we have to follow. And then there has to be a budget in place prior to even bringing on the crew. That's something that should be discussed with an HSM, a CCO, or somebody in the health and safety department so that we can make sure before everything happens that budget is in place, because it's really important.
The interesting thing with you, Tiffany, is that you've worked in 3 different major markets during this past year. And I ran into a situation where I was shooting in Atlanta and a PCR test was $850, where here in Los Angeles, I can get it for $125.
Yep.
So that is a huge budget that really hit the budget on the production side upside the head. We were not expecting that cost. So can you talk a little bit about the differences of those 3 major cities and what you're running into?
Yeah, it's interesting to say that because I'm here in Atlanta now, and the testing prices are higher than what I'm used to paying. It's almost close to $200. Right now I'm at 185, and that's a good deal, you know. I'm in LA getting it for cheap, like you said, 125, 150 the most, and especially when you're bringing in a large group, you get that discount, especially when it's consecutive testing. Here, I think. Because Georgia, it's a limited market in actual testing companies and labs, that's the reason why the prices are so high. I know that I work with a company and we can test 100, 200 people. And if we use a Georgia lab, it's 185. If we allow them to FedEx our stuff to LA, it drops down $50. So it's all about relationships and laboratories and the demand in that particular state that allows the pricing to fluctuate. New York is really great as well when it comes to pricing. I think New York and LA kind of are somewhat similar in the pricing range. And that's because New York is a city like LA, very, very film friendly, have extremely large labs and multiple labs. They're at the hub of a lot of, in the beginning of major crisis. So the city has set out earlier to have a lot of other testing companies come in with laboratories. So it's just an influx. It's about, you know, demand and where we are. And it's just like, unfortunately, Atlanta, because they have limited resources, they can charge higher prices.
Well, even the differences in how you're working too. You were saying that Atlanta, since a lot of things are open there, you're running into issues that the state is open, but your protocols are still tight. Can you talk about that a little bit?
Yeah, it's something that we've been experiencing maybe the past 2 weeks. It's something fairly new because they relaxed the laws now. They have it to where you can take a test. Let's say you're flying to Atlanta on Friday. You can take a test on Thursday, fly into Atlanta on Friday, and work on Saturday. Netflix isn't abiding by that, but that is the new protocol here now. So you have a lot of people saying that, well, this is a protocol. Why can't we do this? Or, you know, the mask, although it's mandated, supposedly a lot of people aren't wearing masks. People, you know, the restaurants are open, bars are open. So I'm getting pushback from crew because you can walk out of the studio, walk out of location, and everyone is just living day-to-day life like it's like COVID isn't happening. And it does give a false sense of urgency when it comes to being safe when you walk outside and your state is just like, hey, free for all in a sense, you know. And with Texas and all those other states not mandatory, having their masks not being mandatory and PPE not mandatory, I think that Georgians are just being way more relaxed. So we've been kind of whipping the chain, having a lot of Zoom calls with doctors and people from health and safety to kind of constantly reminding the crew we're doing this every 2 to 3 days with new onboarding crew, just to kind of keep it fresh in their mind and letting them know that yes, Georgia may be open, but when it comes to Netflix, we're not abiding by that.
Quick question do you know if Netflix requiring mandated quarantine after travel?
Well, it depends on the show, and it depends on if Netflix, excuse me, is the production company or if it's a sub-production company. When it comes to the sub-production companies, they have their own protocols. When it comes to Netflix, yes, we're asking that our talent be tested 48 hours to flying in. After they fly in, they're quarantining for the 5 days. We test them twice within the 5 days, and then they're able to come to work on the 7th or 8th day.
Nice. Okay. Well, you have a different structure that you've been working with in as well. You're a health and safety manager for Netflix, but you manage the COVID compliance officers, and you're the first one to use this phrase, the infection prevention personnel. So can you explain the differences of those three positions and how you work with them?
Yeah, so me as a health and safety manager, I'm considered like the head of the department. I work closely with all the executive and the HODs with the planning process, and I'm the one who's implementing that to the team and letting the CCOs know what their duties are, what needs to happen, where they need to be. The infection prevention, this person has medical background. They've been through contact tracing. They're like specializing in infectious diseases. They usually come from like Johns Hopkins and all these elite medical backgrounds that I can't even begin to explain all the degrees they have. But I work closely with them because we always have things coming up. scripts come up, creative things come up, and we kind of need to have someone who has a profound background in just how the disease is, how it works as a whole. And what we do is we bounce ideas off of them creatively. If a scene comes up, when it comes to stunts, when it comes to intimacy scenes, when it comes to, how close can someone be to an actor, under a certain testing cadence, all of those questions that we just want to make sure that when we say yes or no to something, it's within reason, and we have that background to say that's okay. So Netflix deals closely with these guys. They're on all their shows. It's there. We rely heavily on them, along with a health and safety team that's a contractor. So it's a different level. So we kind of all collaborate together to get those answers that the ADs and the creative teams and writers need.
It's a true collaboration with all these teams. That's what it sounds like, and that's great.
Yeah, it really is, and especially the show I'm working on. Just a little background: it's a vampire series. It's a new season, so there's a lot of intimacy scenes. There's a lot of kissing scenes. There's a lot of biting scenes. So there's a lot of steps that we have to take in order to keep these guys safe. When we're kissing, there's certain protocols with mouthwash and, all of those little things that we don't typically think about, because when we're back in the filming days, we just have mouthwash on set and make sure the clothes set. But now it's all of these other health things that come into place. So we need them to help us make sure that we have the materials that these actors may need when they're doing these physical scenes.
Let me ask you this, kind of going back to testing with these intimate scenes, you're doing your PCRs every other day, every third day. Are you doing, if there's an intimate scene, are you doing a rapid antigen or rapid PCR before those scenes happen? You have to schedule that?
Absolutely. What we're doing, all of our, we call it Red Zone, which is our performance zone talent. We PCR test them Monday, Wednesday, and Friday, but we also rapid PCR test them the day of stunt scenes, intimacy scenes, all of our background each day, regardless of what testing cadence they come in. When they're within reason with our Red Zone, they're getting PCR rapid tested that day as well. So our testing team is on fire every day, and we have rapid testing on set every day, just for those pop-up moments where crew changes over, someone needs to come in for a fitting, something happens, and we have to switch out someone. We have rapid testing on set every day, which is extremely helpful. You never really realize how much last minute things come up, and when that testing needs to happen, how it could put a snag in production.
Yeah, absolutely. The other thing I want to talk about is scope of work. I think the other misconception is the amount of work that has to go into pre-production by the health and safety managers and the COVID compliance officers. And this is really for Tiffany and Dan. Tiffany, can you start with what is the scope of work that you have to do before anyone steps on set?
So the scope of work that I have to do for anyone steps on set is to make sure that location, the stage, and whatever location that we're in, it can hold the amount of people that production needs to be there for that scene. When it comes to the office, I need to make sure that we have, I work with production to have all the players in place so that we have the amount of space in those offices. If not, we have to change locations if we can't. So I break down each scene with each department. So let me take that back. You're asking the scope of work, meaning that when I first get hired, what has to happen?
Yes, yeah.
Okay, so yeah, I think that people have the misconception as bringing in the COVID team later on. I think that what needs to happen is our team needs to be hired right when the ADs get hired, right when those head of departments get hired, because that's when those conversations need to happen when it comes to any and everything production. And we can iron out a lot of the COVID questions early on in the game versus as time creeps up. And then you're hiring us 2-3 weeks out of filming. And now we're trying to catch up of 3 months of work of prep that we're trying to catch up on when it comes to, like Dan was saying, hair and makeup and wardrobe, making sure that, PPE is needed, making sure that our team is properly built to be able to sustain the amount of crew that they have, you know, all of those things come into play, and finding the right crew and making sure that we can vet people that we know are going to be great for this actual production, and not hiring last minute people because it's so last minute. So it's like all of those things need to happen. We are a crucial part of production. We should be at the forefront in the beginning. And I think that if that happens, it can really alleviate a lot of extra things down the line. I don't know. What do you think, Dan?
Yeah, I agree. There's so many things that we do that I don't know if productions or producers even sometimes are aware of. Like we have, I mean, the minute we get the job, usually we should, like, so I just had a job now, it was just awarded, and I just found out it was awarded. They had reached out to me before. And the reason that that's great is because it's important for us to know, just as Tiffany's saying, to be able to look at the kind of the shot lists and the locations and figure it out. That's the point of having us on scouts. CCO is essentially, you know, it's the head of our own departments, right? We have to kind of manage everything and make sure everything's falling into place, and with production as well. So, and there's tons of stuff that goes on behind the scenes that you might not see, right? So in an example, if we're providing PPE or something, we have face shields. Those face shields don't come pre-packaged individually, most of them. You know, a lot of them might have to be put together, or a production will hand us a box of KN95s that are all, you know, group packaged, which then I have to hand them out like a burrito or something because I can't touch the mask to hand them, right? So there's lots of things that goes on the back end that we do. We don't get prep days a lot of the time to do this stuff. So this is stuff that we do on our own free time a lot of the times, or on the set, which is the time that we're supposed to be doing, you know, other things, so that we don't always get to that either.
So are you
Not
finding
the other things, but the buildings, you know, building packaging stuff or whatever.
So are you finding as well that you're not getting hired in enough time to do your job?
No, and I'll give you a real life example that I just had on a large production had hired me. They wanted to hire me on a you know, like a full-time basis for several months, right? But they had already found their location. They had already found everything they were going to do. They had a studio kind of space, like a warehouse, but it also had office spaces. They brought me in. They wanted me to do, you know, my COVID compliance thing. The challenge we had, though, was they had already secured this lease with this production, with this, you know, warehouse. It wasn't even a production studio. It was just like a warehouse, but they were able to do their thing in this warehouse area. But they had all these office spaces. Well, then they never took into account for ventilation, air exchange, HVAC protocols, filtration, any of that stuff, as well as footprint, right? They said, well, we're just going to put the VT or the D, you know, the DIT and the sound guys and all these guys are going to be in this little tiny room. And like, you can't put 12 people in this little 400 square foot office. So what I do is, you know, and most of us CCOs that are on the game will go through and we verify the space of the place. I double check, you know, with my background in engineering and facilities management and construction. I also can kind of come in and go, look, I know that when was the last time you serviced your HVAC system? What is the filtration rating? Is it a minimum 13 MERV 13 filters? If we're going to be in here, can we keep the exhaust fan running continuously? Is it going to be a challenge with that? Is there going to be eating or drinking nearby? There's so many things that goes into it. And just as Tiffany said, we break down the shots because I need to know who needs to be where when they need to be there. I need to know when people are coming in. I need to be able to know how to get a hold of people. And sometimes I don't even I've had productions don't even want to send a call list because maybe it's non-union, but they got some union people crew and they don't want them to know to get them in trouble. And it's like, but I have to know how to contact them because, believe it or not, we do check like the health screening questionnaire. So if I find, when I go through, before I go to bed at night, I look at it, and before I wake up or when I wake up in the morning, I look at it before I do anything else. And, you know, managing testing and everything else we kind of do as well. So when we're looking at all those things, I have to be able to go, well, wait, whoa, this guy just said that he's living in a house with somebody who has been diagnosed with COVID-19. I need to reach out to that person to figure out why they said that, if that's actually the case, and they're not coming to set if they're, you know, unless it was an absolute error or something like that. So there's a lot of things that go into it, and we just need to be involved in it so that we can communicate with you. Otherwise, you don't want us calling saying, oh, Joe can't come in now, even though he showed up and you're all ready to go, cameras rolling. He's not allowed in because he didn't do anything.
Right. Well, here's the other question too. You know, the scope of work. We have a question from Philip here that is asking, have you guys, when you come in and you do your breakdown, you know, I work at Vicom, sometimes you're turning in a 150-page document explaining each scene and how everything's going to get shot. If you go into a location, do you have the power to shut it down, or have you ever been in that situation? Like, this is completely not going to work at a location. Like, how do you work on those situations where you know that this isn't going to be workable based on what they've given you?
It's various. So I, like on that instance with that office or that office location warehouse, I actually had declined the position. I had gone out there, I'd taken the time to walk the site with them. I did all these things, and I did that, for free, essentially. I told them I'd come out and just take a look at it because I wanted to make sure that I wasn't putting myself in a situation or putting them in a situation that wouldn't be beneficial for them, right? So I wanted to make sure that, so I did this, and then I turned down the position. I explained to them, here's an email stating exact reasons why. And here's my primary concerns that I suggest you deal with if you want to be successful and not have an outbreak at your facility. The other side of that is I'm sorry, the original question, I got distracted on that, but what was it? Just refresh me.
Well, if you have a situation where it's not going to
shutting it down,
shut down a set because this location does not work. Yeah,
absolutely. I mean, having that, I guess, the fortitude too, to be able to say, listen, guys, we need to pause production because this isn't safe. And I've had that. I've had instances where, maybe day 4, everyone starts getting too lax and nobody's following the direction and this person's not doing this. And we have to say, everyone just stop. We need to take 1 second to figure this out so that we can make sure that we are safe and compliant going forward, because they'll set up, catering I've had catering set up a buffet before, which they cannot have. And then you have to stop everything to get catering to move everything so that people can eat. And if we have to shut down, we do. And I know of CCOs that have whole teams of CCOs that have walked off a set because they weren't taking the proper protocol. And then we report them to the county or whoever we have to then follow up and deal with that issue.
It can get serious if you don't work with your CCO, is what you're saying. So
I mean, we're here to help you. We're allies. We're not the enemy. We're not here to micromanage. We're not here to see if we can, cost as much money as possible for the production. We're really just here to do as much as we can to keep production moving safely, responsibly, and smoothly as possible.
We're at the 10-minute mark right now, so I want to go to the producers' questions right now. And the first one is for Dr. Chen. If someone has cannot have a nasal swab done for medical reasons, can you change the sample to a throat swab? And explain it as PCR versus antigen.
Got it. Yeah. So this question has been brought up quite commonly, and the answer to that is you can change it to a throat in certain circumstances. So if you're talking about PCR testing, because PCR is so sensitive, you're able to change from a nasal to a throat. And most of the time, the test kits that get authorized by the FDA, they also put sort of the specimen types that you can collect and that they're authorized under. And almost all of the PCR ones have, nasal, nasopharyngeal, and what we call oropharyngeal, which is back of the throat. And they'll typically be authorized for all 3. If you're talking antigen testing, I have yet to see an antigen test kit that has been approved for both nasal and throat. And things change. Maybe a week from now, I'm going to be, this information is completely wrong. But from what I've seen, and at least I've looked at, all the antigen-based testing is only authorized for either sort of shallow nasal or deep nasal. So I haven't seen throat collection antigen that's been approved.
Gotcha. Thank you. I want to go back to Tiffany for a brief second. Since you've worked in the non-scripted and scripted areas in the last year, can you break down very quickly the differences that you've seen as an HSM and how you've dealt with that?
Yeah, for non-scripted, the differences I've seen is that because there's no set rules and laws, production companies really can set their own protocols as long as they meet the CDC requirements. And I think that with the non-union, because budgets aren't always there, it tends to be extremely lax. It tends to really start at the head with the executives not complying and not wanting to comply and not wanting to wear their PPE, and it just dwindles down to the crew not complying. So honestly, I've kind of pushed away from the non-union world because I find that I put myself and my team, who I travel with often, in uncompromisable positions, and that's just not something that I'm willing to do. The testing cadence isn't usually as frequently as I'm comfortable with being. I think once a week is not the best thing to do. I think we should be testing people more than that. And I understand that, like I said, it's budget, you know, their budgets aren't always there. So therefore the COVID team does suffer, you know, and the COVID protocols does suffer. When it comes to union, because there's so many union laws, I think that they're a lot better, not great. I think that a lot of producers coming out of the pandemic and first productions aren't always listening to the CCOs with their advice and when they're implementing certain things, because they don't necessarily understand. And sometimes they learn the hard way when we're actually already in production and all these things need to happen and all these things to be in place. And then it's like, oh, wow, I should have listened, you know? So sometimes it's too late. And we're always trying to prevent things. Understand that your CCO sees things and will ask questions that you don't even think about to ask. And we're going to bring things to your attention that you didn't even realize needed to be brought to your attention. And we're not doing it to be nitpicking. We're not doing it to get more money out of you. We're not doing it just for the sake of it. It's because all those things help with keeping the crew safe. Like Dan said, the HVAC systems, you know, the MERV filters, like having extra filters in your dressing rooms and wardrobe areas, all of those things that you don't even realize needs to happen that have to go along the protocols for the actual state and the county that we implement. And we realize that these things change often. So it's our responsibility, as me and Dan's and everyone else's, to make sure that we're on top of all those protocol changes that happens every day, every other day, that we're constantly reading and keeping production and producers abreast with what's going on. So even when there's changes, don't get mad at us. We're just giving you the information as we're getting it, because it's ever changing and it's consistently changing. So as long as people get that into their heads that no rules are the same rules that's going to be there for forever. As things change and as, you know, protocols change and as testing, as states start to lock down and CDC starts to bridge down, things are going to change. And we just have to address that in the moments and keep it, you know, and keep it light and keep it moving.
Well, one conversation that's been ever changing is the mask rule and what's accepted and what's not. And Bob Johnson is asking a very great question. And I want to hear what you guys are doing on set, Dan and Tiffany. And then I want to hear from Dr. Chen what he suggests. So the question is, are 3-ply masks in use on set, or is N95s or K95s the only mask allowed? And then I want Dr. Chen to say, what do you recommend for sets?
I recommend the KN95s across the board. They give you the most coverage. They're better than the 3-ply surgical masks. They're not as stringent as I think it's the N95. So I think that's the best. I try to keep the mask protocol across the board and not switch it out between surgical and K95. It confuses the crew. So I think that production, if you're gonna stick to a mask, stick to one type. Definitely don't do the cloth mask, the handmade cloth mask. KN95 is the best. That's just my personal opinion and just what I've seen from productions usage through Viacom and Netflix. They've really been pushing the KN95s.
Dan, what are you guys using on set?
I agree. I always push KN95s. Surgical masks, they do have a tendency to be loose. They fit looser. They are easier to breathe, which is why people prefer them most of the time. But they don't offer that same level of protection, right? If you've got a gap side open and you're breathing, you're just venting it back behind you with the next guy who's standing there, or the guy that's going to walk past you is going to get. So KN95 across the board for myself is what I usually recommend. I definitely the same with the cloth mask. And the reason too is early in the day when they were doing cloth masks, or some productions would opt to do a cloth mask versus a KN95, is they don't fit all the time. I'm sure we all know somebody who's wearing a cloth mask that's hanging off their face. You're like, well, I'm still wearing a mask. And you really have to get into the minutia of, sir, the mask is not worn properly unless it's covering, or, you know, sir, ma'am, it's not unless it's covering your nose and things like that. If I can see your nose, it's not working.
Yeah.
Dr. Chen, what do you wear?
KN95 across the board. And I'll give you guys a bit of backdrop so you understand the context more than anything. The 3-ply surgical masks are exactly that. We use them in surgery, and the whole reason why we use them is basically for blood splatter and for any sort of like organic body splatter. So you're there in surgery, let's say you're doing cardiac surgery, right? The last thing you want is blood splatter going into your nose and mouth. So really that's why it's very wide as well, because it's there to protect against fluids more than anything. It's really not built for ventilation purposes. So for example, if we perform surgery on a patient and let's say they've got influenza, let's say they're a positive influenza and it's an emergency surgical case, you'll see all the surgeons will swap out the KN95s because they know for a fact that now there's a respiratory risk at play, they'll swap them out. So absolutely KN95s or the N95s.
Nice. We haven't talked about foggers at all. I'm getting, Stephanie Dawson is asking, are there disinfectant foggers really helpful, and are they required?
They're not required. Are they helpful? Yes, they're helpful in the sense of you're able to sanitize a large area at a larger time, but that should be supplemented with disinfecting of the surfaces and areas, and then fogging should be an added solution. It shouldn't be the only thing. I recommend fogging at the end of the night, all the hair and makeup trailers and your stages and things like that after everything has been sanitized. But foggers shouldn't be our only use of sanitization.
Agreed. Susan Reed is asking about are production bubbles better approach to filming certain projects? Are you guys changing your shooting days? Are they shorter filming dates, better for safety? How have you adjusted from our normal 20-hour days?
Yes, I would say pods and bubbles are definitely, you guys should, if you can, it should definitely happen. We usually do that with our main talent and the people who are with them. So to be like the main talent, hair and makeup, our DP and our camera guys who are going to be within 6 feet of that talent. I know some productions, as well as on Netflix, what we do is we bubble everybody for about 2 weeks in a hotel, kind of keep them isolated. Get them tested throughout a cadence and have them, and then after that 2 weeks, they can go into their homes living alone by themselves. If not, we do test everyone in the home on a regular testing cadence. But that's just to secure that we know coming into the first chunk of production that those guys have been sequestered and cleared and have been isolated, and then we can go ahead and move forward.
Dan, what changes have you seen?
Fresh. It was just in the sense of the pods and such.
Just how have you guys changed, since you've worked in production before, what major changes have you seen? Have you seen shorter work days? Have you seen?
Oh, yeah.
No,
I wish that we did have, I know that in the beginning when this came out, they said, recommendations were 10-hour shoot days or something like that. That hasn't happened yet. That's never going to happen, I don't think. We've kind of given up on that. However, we just do what we can to keep people safe. We also encourage, changing your mask frequently throughout the day or something, at least twice a day. You shouldn't be going 8 hours with that same mask in the same numbers and things like that. So we usually encourage people to change your mask, after lunch or whatever. And pods, anytime you can, keep them in there. But we also have to keep in mind too, it kind of goes to that same like testing cadences and testing frequencies. That kind of, one of the things that's always kind of, I guess, bothered me about that is that whole idea. Well, we only have to test the talent. Everyone else can just show up. We don't have to test them. And it's like, well, it's almost like classism here. You're saying, okay, well, I'm just going to throw a name like Kevin Hart gets tested, but nobody else gets tested, and we all get to take the risk. So, I mean, it's important that we all keep in mind that we're all humans. We're all deserve to be safe.
And Carrie, I'll add that I've seen that it hasn't been the days have been the same, but I have seen production spread out, meaning that if it takes, for instance, we did RuPaul's Drag Race, and usually it takes 3 weeks to build that stage. But because of COVID, we had to extend where only certain departments could come at a time to start to set up and to build. So that 3 weeks went into 2 months because we were taking protocols to make sure. It was one of the first shows coming out of my production company, and they're actually on Viacom as well, RuPaul. And it was just like, we were just this was in May of last year. So right after the major 2 months of lockdown. So we did extend it. So instead of having it a 2.5 month shooting period, it was 3.5 to 4 months almost.
Wow, that's great.
Yeah.
That's fantastic. I have a follow-up question for you, Dan, from Philip. Adding to my question, in light of Dan's location concern, but in this world, how realistic is it to find an office with all the specs that they want to check off? That is, would you write off a production for lack of a timely find of an office, finding an office?
No, I wouldn't. So I wouldn't write them off. And once again, my job isn't here to, be the, I guess you say, like the bureaucratic guys, like, no, you can't do that. My job is to help you come up with a solution that is safe and effective and needs to be done, right, for everybody's safety. So what I do in a circumstance like that is we have that conversation. The challenge is on some of these where the producers weren't interested in making any of these changes that would have involved, and they didn't have the conversations with the proper people like the landlords and the property managers to make sure that we could do that. But those are conversations that I'd given them the opportunity as well to, when we had these conversations and over these conversations to correct these things. Say, here's my recommendations. If you guys do this, this is where I think you'll be. So we're not writing off all offices necessarily. They just have to be, you have to take into consideration the double-sided of it, right? One, you got the office protocol, and then the other, you have a film production protocol. So it's just kind of doing that and making sure that you're looking at the whole picture to do it and coming up with in collaboration with production and the producers and everyone else to come up with the solution that's viable and safe.
Great. And then this question is to everyone in your, what have you seen the biggest misconception or the biggest mistake that you just want to correct and get people back on the right track? We've been in this for a year and there's still so many outstanding questions and where we're going to be in the future. Is there anything that you've seen in your industry of what you've been doing that you want to correct and educate us now, so when we get back out in the field, we're not going to do that thing?
It's the simplest thing is the two simplest things that's going to keep us safe: wearing PPE and washing our hands. If we can get those practices down, if we can do that, if we can wash our hands every 20 minutes or so, if we can sanitize our hands every time that we touch a doorknob or a rail or a touch surface, if we can wipe down the microwave after you touch the handle or the refrigerator inside of the pantry area, those are all the little things that come into play that if we can put those in practice, it will help out the CCO team, and it will also make a world of a difference. It's always the little things that make the greatest assets.
Dan?
Yeah, I think that's it. I think it's communication with your CCO team. It's piggybacks on the same thing Tiffany's saying, right? The PPE, wearing them properly, leading by example, doing just that. Understanding that when we say, my biggest thing, and I told you this, Carrie, on the phone, the thing that I love here and I also can't stand is I'm eating. Sir, you need to please step away from that. I'm eating. I know you're eating. I'm not saying you can't eat. I'm not saying you can't drink. We all need to eat and drink. However, you can't eat and drink inside this person's mouth pretty much. You need to step back and give yourself some distance. So it's a constant thing that we deal with. And, and sometimes people get upset, they got their mask on. I say, hey, Sarah, do you mind putting your nose back on? I was just breathing. Like, I get it. You're just breathing, but that's the problem. You're breathing without your mask. So it really just comes down to that communication and working with it. And not everybody can do this job well, right? So just like I said, just back to kind of that PA thing, and I hate to keep saying PAs, but it's an example, and it drives me nuts when I see it, is they'll go, well, we have a COVID safe PA, right? And that COVID safe PA, do you honestly believe that COVID safe PA is going to feel, or that COVID PA is going to feel comfortable walking up to the director telling him to put his mask on? They've been working as PAs for 15 years in this industry. Now all of a sudden they're going to tell the director, who's supposed to be the top guy on the set, that, and EPs and everybody else, that they can't do that. It doesn't work. So just work with us. We're not here to, we're the good guys. We're here with you. Dr.
Chen?
For me, I have two. The first one is definitely vet your vendor. What I've definitely seen in the lab space in the last year and a half is a lot of people have entered the space because they see money on the table. They say, look, this is their existing, whatever they do in their 9 to 5 is no longer viable. And they say, look, let's go into lab testing. And a lot of these people will just jump in there, make money and leave. You heard about that at the start of the pandemic when people were doing government bids and the government paid them and then they ran away with the money. So number one, vet your vendors. Absolutely, 100%. I would say, especially your lab vendors, because they're going to be what, along with the CCOs, are going to be what really makes your production smooth or not. So, and with the vendors, like vetting them, make sure they have a good customer service person. You don't want to sign up with a vendor and suddenly they're MIA. I mean, what good is that to anyone? And then the second thing is to make sure that with your testing protocol, that you make sure you establish your frequencies like appropriately, I guess is what I'm saying. And make sure that you've got the right testing platform. So what I mean by that is that I've seen quite a few productions move towards antigen versus PCR. And I understand budget reasons. I completely appreciate and understand that. But one thing that I always keep in the back of my mind is that, well, PCR testing is about 100, sometimes even 1,000 times more sensitive than antigen testing. PCRs are very, technologically sound. Methodology of testing has been around for multiple decades, and we all know about it very well in the medical space. So I guess, if you feel confident with antigen testing, then go for it. But I'm always strongly of the belief that PCR is the way to go. So make sure that your testing protocol, that you're confident in it, is what I'm saying, and then just go with it.
I love it. Well, thank you all so much. Our hour is actually over, gone a little bit over, so thank you for staying a little later. And I really appreciate Dan, Tiffany, Dr. Chen, thank you for doing this. And we at the AP Council, working with the Safety Task Force, we have more of these panels coming up. So keep an eye on your newsletter. I think we have 3 more scheduled. So this is a very important topic. We're very passionate about it. And we can answer those questions for you along the way. Thank you again.
Thank you. Bye,
Thank you
guys.
very much.
Thank you,
Bye,
everyone.
guys.